Hi everyone. Okay, so welcome to today's live stream. We are talking about a condition that is extremely common in clinic, but also very commonly missed: sacroiliac joint pain. Many patients say things like, "My buttock hurts deeply," or "My lower back feels stuck," or "Turning in bed is painful," "Standing up after sitting hurts," "Walking gives me deep head pain," or like "It feels like sciatica. I treated my lower back, but it never fully improved." And very often, the real issue is the sacroiliac joint. So today, we'll discuss Western anatomy, biomechanics, common symptoms, MRI and imaging findings, why it gets misdiagnosed, and TCM understanding, acupuncture treatment, and clinical experience. Okay, let's start. So what is the sacroiliac joint? We call it SI joint. It's a joint between the sacrum and the ilium of the pelvis. In simple words, it connects the spine to the pelvis. Many people think this joint doesn't move much. Actually, it moves only a small little bit, but it is extremely important. Why? Because it helps transfer body weight and stabilize the pelvis, absorb like walking forces, and connect upper and lower body. It's like a connection point. It's connected, and it's working like a cushion to sort of absorb the walking forces to make you function better. So every time when you walk, run, or bend, or even turn in bed, the SI joint is involved. Why does SI joint pain happen? Well, there are many causes. The most common one is instability. So what causes the instability? For example, some common causes like getting pregnant, pregnancy, childbirth, weak core muscles, poor posture, prolonged sitting, and standing unevenly. And over time, the pelvis become unbalanced. Then the SI joint becomes irritated and inflamed. So everything causes the unbalance of the pelvis will trigger the SI joint pain. Another major cause is lumbar spine compensation. This is very common. Patients may already have lumbar 4, lumbar 5 degeneration, disc bulges, spinal instability. The body then compensate by making the muscles tighter, shifting the pelvic mechanics, and overloading the SI joint. So eventually, the SI joint becomes painful too. Also, another cause, very common, trauma. When you have fall, and of course, car accidents, lifting injuries when you're trying to lift very heavy objects, twisting, when you're twisting in a weird and sudden movement, all can directly stress SI joint. Pregnancy and postpartum. This is extremely common clinically. We know that during pregnancy, the body reduces a hormone called relaxin, RELAXIN. Yeah, it tries to make you relax. So there's a hormone called relaxin, which loosens the pelvic ligament for childbirth to make childbirth easier. but sometimes after delivery, the pelvis never fully stabilizes again. Patients then develop turning in bed pain when they are trying to sleep, and pain will carry in the baby. Standing pain for too long, they will have pain. Single leg pain feels like sciatica, and deep buttock pain. That's very classic SI joint presentation. Now we're coming to the question that what does SI joint pain feel like? Most of my patients think SI pain is just buttock pain. Actually, it can cause lower back pain, deep glute pain, groin pain, posterior thigh pain, and lateral thigh pain. Say it is very similar with sciatica. Sometimes it feels almost identical to sciatica. That's why it is commonly misdiagnosed. But there's one very important clinical clue. Patients often point to the PSIS region. It's a little dimples near the lower back. They say, wow, it hurts deeply right there. That is extremely typical. You may ask, what movement triggers it or make it worse, aggravates it? We have some classic aggravating movements include turning in bed when you try to turn when you sleep, standing just on one leg. Some people, they are doing that for fun. And getting out of a car after driving, climbing stairs, that's very important cause as well. And when you are changing from a sitting position to standing position, or when you're trying to putting on pads. Why? Because all these movements create shear force through the SI joint. Some patients, actually a lot of patients, told me that, wow, the pain feels worse at night. Why? This is very common. The patients say that I can manage during the day, but once I lie down, the deep ache starts. Because the SI joint is a stabilizing structure. During the day, muscles help support it, but at night, muscles relax, then the underlying instability becomes more obvious. Let's try to explain this again. During daytime, it's yang dominated in our way, yin and yang, and the muscle helps to support, make it more stable. But during night, when yin dominated, muscles are more relaxed and the instability shows up. In Western medical perspective, it paying much more attention to SI joint pain now. In the past, many patients were simply labeled disc bulge, but now we know many cases are actually SI joint dysfunction. Doctors may ask you to do MRI. In MRI, interestingly, a lot of patients, their MRI shows normal because SI pain is frequently functional instability. So it's not structural. It doesn't usually have severe structural damage. That's why you can't even say anything in the MRI image because structurally nothing changed. It's functionally changing. But the images sometimes do show that you have SI arthropathy, inflammation, sclerosis, and subcondylosis. But again, not always. So how about in TCM perspective? In Chinese medication, this often refers under B syndrome. It eventually involving different channels, which we call bladder channel, gallbladder channel, stool channel. So the bladder channel, it runs at the back like that around the buttock, and stool channels is in the middle of the back, and gallbladder channel is on the side. That's where the SI joint pass. We have some common TCM patterns. The first one will be Calldean B syndrome. That's very common when you feel deep aching pain and the patients feel it worse with cold weather, or it's stiff, quite stiff, and also the humid weather like raining make it worse. That often refers to cold damp pain because there's something cold and dampness inside your body and you couldn't get them out. So every time when the weather gets cold or humid, you feel the pain. The second pattern is qi and blood stagnation. Some patients said that when I'm standing there for too long and I feel the pain is fixed, they can pinpoint where the pain is, and sometimes the pain feels a bit sharp. Also, they have night pain and deep tenderness, so it's all deep. And they have other chronic unresolved symptoms. That usually refers to stagnation, when something is stuck there for too long and you are not able to move it. The third one is quite common as well. We call it kidney deficiency, especially in chronic cases, because in TCM we see the kidney governs bone. Patients may have chronic lower back weakness or knee problems or pelvic instability, fatigue, low energy, and weak legs like the knee problem. It's all referred to kidney deficiency. Now let's talk about why lower back treatment often fails. We have some patients who got only received treatment for their lower back, but it's not working. Why? Because the actual problem may not be the low lumbar spine. Many practitioners only needle, we call it bladder 23, bladder 25, which is located right at the back beside the spine. But the true problem is often around SR ligaments, gluteal attachment, and deep stabilizing muscles. Local treatment is actually extremely important. You can add those bladder 23 or bladder 25 points, but please also add some local points as well to try to relax local points, local muscle. Now I have some acupuncture treatment strategy. We have different stages of acupuncture treatment. The first one is acute stage, when patients had it suddenly and we focus on reduce inflammation, try to relax muscle guarding, and relieve pain. Some common points we use are around the back and around the SI joint, also piriformis region. That will be enough to help with the acute stage SI joint pain. And in acute stage, the results usually show very fast because you just had it and it's not, the pain's not staying there for too long. We are be able to resolve it faster. That's why one of my suggestions is that do come for treatment as early as possible. Do not wait until it takes too long. Now we are coming to the chronic stage, and we are not focused on reducing inflammation anymore because there are probably no inflammation at all. So we are focused on more like stabilization and trying to improve circulation and to tonify or strengthen kidney system and reducing chronic tension, because many chronic SI cases are actually instability problems. Another part I'm going to talk is why glute muscles matter. This is quite important, especially gluteus medius dysfunction. Weak glute median muscles create pelvic instability. Then the SI joint try to compensate with that weak muscle. That is why rehabilitation matters very important, not just acupuncture treatment. There are some common clinical mistakes as well. For example, like I said before, when practitioner treating only the lumbar spine, but when the actual point is a pelvis, and you are treating the wrong side. Also, excessive aggressive manipulation. When we use the needles and the sensation is too strong, well, some unstable SI joints become worse with repeated forceful adjustment. Another thing is resting too much. It only provides short-term relief, but long-term still create instability. So it's not you resting more, the better. And now we're talking about who commonly gets SI joint pain. Well, very common in postpartum patients, like what I said before, those ladies who never recovered from the relaxing hormone, which causes the relaxing of the pelvis to get easier childbirth. And office workers who are sitting there for too long, drivers, again, sitting there for too long, some runners who always running, and people with weak core muscles, they are just built up like quite weak. And chronic stress patients, that's happened a lot in social life now. It's quite stressful, especially for some patients who under chronic stress. That's more common because stress causes the glute tension, muscle tension, and pelvic gardening, and shallow breathing. Instead of deep breathing, patients with very chronic stress, they have shallow breathing, and this eventually overloading the SI joint. That's related to SI joint pain and emotions. In Chinese medication, it strongly emphasizes the liver governs tendons. With long-term stress, frustration, emotional suppression, that can also create pelvic tension, PSOS tightness, and glute tightness. So many chronic SI cases are not purely structured, they are also nerve system problems. So do get managed of your stress level. That will help with the relief of SI joint pain. Some advice I'll give you today: try to avoid prolonged sitting, like what I said. The office workers do get more often for the SI joint pain, and especially sitting unevenly. If you have to sit, try to sit in an even space, and avoid standing on one leg. Some people, this is a very common habit for them, but it actually causes a lot of stress for the SI joint, creates instability. Always keep the area warm, especially cold damp patterns, especially for those patients who feel worse immediately with cold exposure. Do wear warm pants to protect that area. And some gentle core rehabilitation, which focus on deep core and breathing mechanics, but please not aggressive at minimal abdominal training, just gentle. There are some red flags you have to know. If you have bowel or bladder dysfunction, or you have very severe leg weakness, you can't even walk, and numbness, you have numbness which rapid worsen, and fever, high fever, or unexplained weight loss, then it's time to go to see a doctor, because we have to rule out Calldequina syndrome, infection, tumor, and inflammatory arthritis. So not every buttock pain is simply SI joint pain. Be to have this something bear in mind. Let's do a summary of what we talked today. Sacroiliac joint pain is not simply buttock soreness. It is a pelvic stabilization disorder. Western medication looks at biomechanics, instability, inflammation, but TCM looks at B syndrome, liver and kidney imbalance or deficiency. Cold that
Are you doing a live stream?
yes.
Okay, I'll do that. I'll tell you to wait.
Who?
It's just the patient wanting to talk to a practitioner.
Okay, give me 5 minutes. Give me 5 minutes. Whose patient is a new patient?
Yeah.
Okay, I'll call.
Okay.
Yeah, so sorry. Hello, it's Kate speaking. How can I help? Oh, how about now? I'm good, thank you. How are you? Yes. Mm-hmm. Okay, so it's how old? Right. Okay. How do you mean old shoulder? But how old it is? How many years? Okay. Right. Right. Does it help? Okay. I see. Okay, so it's the old shoulder pain and neck pain. So for both shoulders or just one side? Okay, I see. Yeah, so I think I can be able to help, but because it's quite old, but because we diagnose with channels, when channels blocked and you got lots of pain, and we use needles to unblock channels, which helps, and also fire cupping, sort of different methods. So what? Sorry, what's her name? Steven. Okay, so Steven, do you want to come for a treatment? It's 1 hour treatment, and let's see how your body responds. So without seeing you and without giving the treatment, I can't guarantee it will be better than you were before. Yeah, but how about you try and you feel it? If it works well, let's continue. If it doesn't, then you just figure out something else. Is that okay for you? Yeah. Okay, so you won't have on Saturday. Okay, sorry, got a patient call. So yeah, it's pretty much everything I talked today. So we in TCM will look at different things, and believe that treatment is not just pain relief. It's like regulating the nerve system, improving movement, and reducing chronic tension and stress. So holding tension for too long is not good. So if you have that problem, please come for treatment today. Thank you.